Hey guys, so in this video we're just going to go through how to measure range of motion using the goniometer and also have a look at the difference between active and passive range of motion and when you might use the inclinometer versus the goniometer. So what we're going to go through here with Nirav is just shoulder flexion range of motion. So Nirav's just going to show us the action of shoulder flexion on his left side first and foremost. So just take his thumb up towards the ceiling and come down. So obviously here this is an active range of motion assessment because Nirav is performing the action, so he's taking himself into shoulder flexion. What we need to do with the goniometer to line up a couple of key points. Firstly, we have the axis of rotation of the goniometer, which we line up through an imaginary axis of rotation through Nirav's shoulder. So we can give it a couple of practice goes, so Nirav can just go through the movement again, and we can imagine where the axis of rotation would be passing through this joint. So the key thing with shoulder flexion range of motion is not actually picking out one spot and trying to keep the axis on there, because what you'll see is if Nirav moves, that's not really going to work out too well for us. So we actually pick an imaginary point that's going to go through his shoulder. So I'm going to pick that point here, line the axis of rotation up with that, and then have the immovable arm in line with his trunk or his body. Okay? So as Nirav moves through shoulder flexion, which we'll do now, I keep the stiff arm in line with his body, and I take the movable arm, and I keep that in line with his humerus. And then when he's at the end of range, I make sure my 2 points are lined up, my 2 arms are lined up, and that my axis is still on the axis of rotation. And then he can relax there, and come back down. And then we have our angle here. So we'll just scoot in here. We can see we have a reading, and we're around about 155 degrees shoulder flexion range of motion. So that's an example of how you would use the goniometer. An example, well I guess first and foremost, we'll do a comparison now between an active and a passive range of motion assessment and where you might use an inclinometer versus the goniometer. So I'm just going to get Ralph to jump up onto the bed. So just on your back, mate. So here we're going to compare a test of hamstring flexibility. So we're going to firstly do an active range of motion assessment called an active knee extension test, and I'm going to use the goniometer firstly for that. So Nirav, what I'm going to get you to do is hold your thigh up at 90 degrees. So we can already see with some hip flexion, the hamstring muscles are going to be on a little bit of stretch. And then from there, I'm going to get Nirav to point his toes down and then extended his knee. So basically, lifting his lower leg up towards the ceiling as far as he can go. So go for it. So we're going to say his active range of motion of his hamstring muscle. And to use the goniometer here, I line the stiff arm up with his thigh, the axis of rotation through his knee joint, and then the movable arm along his lower leg, pointing down towards his lateral malleolus. And then we get a reading. And so from there, if we were to imagine that 0 degrees would be all the way down here, and then here we have all the way up past 90, about 143 degrees range of motion. Now you could take that reading a couple of different ways. If we were to use the inclinometer in this example, where I would actually start from is this point, which here is read as 0, and then when Nirav extends, all I have to do is leave that sitting on there. And we can see now we're at 45 degrees and come back down. So when we use the goniometer, we've got about 145 degrees range of motion. And that's because we were adding that on to 90 degrees, whereas we were calling this point 0 with the inclinometer. So when you go up to 45 degrees, that's what you get. If we added that to 90, that would be in a similar ballpark to what we had with the goniometer. So we see we can get slightly different readings depending on how you orientate the inclinometer to start with. The beauty of using the inclinometer is it's a little bit less fiddly. Now the other thing we can do here, that was an active range of motion assessment. I'll show you guys now a passive range of motion assessment. So Nirav's going to be in the same position, but this time I'm going to do the work and I'm going to move the joint through range of motion. So he's just going to be really heavy and relaxed with his leg, and I'm going to move up until he tells me to stop. So I'm going to move up, and when he gets to the end of range of motion, I feel a bit of resistance. That's the end of his range of motion. And to make life easier for me, I can just stick the inclinometer up on his shank and I can get a measure, which here is a little bit further. We're about 55 degrees now. So you can see with the passive range of motion assessment, because I can push him a bit further, we can actually get a little bit more range of motion compared to if we look at an active assessment. You can see how difficult it would be for me to use this, the goniometer, if I'm trying to move Nurab's leg with one hand, stabilise his thigh with the other hand. I don't have too many hands left to be able to use the goniometer properly. So this is where something like an inclinometer is a lot more useful for a test like this, where you actually have to use your hands to assess your patient or your athlete that you're working with. So hopefully that gives you a bit of an idea about the difference between these two bits of equipment and also the difference between an active and passive range of motion assessment. Any questions, guys, as always, feel free to come and have a chat to us and we'll go through this in more detail in the tube. Thanks, guys.